Hi, my name's Tyler Brobst. I'm a student at State Fair Community College. I'm taking a physiology class, and I am doing a presentation on leukemia. Leukemia is a cancer that is found in blood and bone marrow. It arises in the bone marrow, and it's caused by the rapid production of white blood cells. That impairs the ability to make red blood cells and platelets because it gets too crowded. White blood cells normally help fight infection and grow and divide as needed, but in leukemia, um, they're not. The white blood cells aren't fighting infection. They're not growing and divided right. Like in leukemia, the white blood cells are dividing rapidly. Leukemia is actually the most childhood type of cancer. So, like a description of leukemia is when it starts when the white blood cells have a mutation in their DNA. It causes, like I said, the cells to grow and divide. While, like in a normal cell, they would die. They're just constantly multiplying. This makes it to where the healthy cells can't grow and function normally. Leukemia can spread to other parts of the body, such as the lungs, the heart, and the kidneys. Some of the risks that for leukemia include smoking. If there's like a family history of leukemia, there's like some chemicals like benzene that can increase your risk. Genetic disorders such as Down syndrome. And if you've had cancer in the past and you've had chemotherapy or radiation treatment, that can affect it. They classify leukemia into 4 different groups. The first 2 is based on how fast it progresses. It can either be acute or chronic. And acute leukemia, the immature white blood cells, they reproduce rapidly. It makes it to where the bone marrow can't produce healthy cells. This is actually the most common type in children. On chronic leukemia, the white blood cells are normal. However, they are mature. So, like in acute, they were immature, and this one, they're actually mature. And this one, they build up slowly. It can take months or years for it to progress. So a lot of times it will show up later on in life. But it can actually happen at any age. The last 2 types is the type of cell that is involved with. Can either be lymphocytic or myelogenous. In lymphocytic leukemia, it affects the lymphoid cells, which makes up the immune system. And then the myelogenous leukemia affects the myeloid cells. That affects like red blood cells, white blood cells, and the platelet producing cells. So in some you have acute lymphocytic, acute myelogenous, chronic lymphocytic, chronic myelogenous. Some of the symptoms you have include fevers or chills, frequent infections, swollen lymph nodes, and enlarged liver or spleen. There's some lab tests they can do. Some of the labs will show like a decreased red blood count, decreased platelet count, or an abnormal white blood count. There's a bone marrow test they can do that can also actually show the growth rate of the leukemia. Sometimes they'll do biopsies of the other organs to see if it's spread. Some of the treatments they have for it, common ones, just like kind of like any other cancers, is radiation therapy, chemotherapy, stem cell therapy, and immunotherapy. That brings me to the end of my presentation. Thank you for watching.